Did you know that olive oil can have the same effects in your body that ibuprofen does? You know, it's not just healthy fat. Somewhere along the lines, fat became the enemy. It was actually back in the 1970s when fat became vilified. There's a whole other story to that we'll get into some other time that the sugar industry was actually behind. But the good fats can actually act as a bioactive signal to your body and do all kinds of good stuff for you. We'll talk about this as we go along. Hi everyone, Dr. David Sugar here with UnProcessed Sugar. So think of fats not as the enemy, but actually as a medicine. Now, olive oil is not just calories, it's actually good fats, and again, it's a bioactive signal to your body. Now, not all olive oil is the same. You know, cheap grocery store olive oil is not equal to extra virgin olive oil, which is what you want. Cheap grocery store olive oil is actually old. The way it's processed isn't necessarily the best. It's not stored it the right way, clear bottles, not, hot temperatures, things like that. So you want to make sure that you get extra virgin olive oil, in particular because it's the way it's processed. It's the least processed. It's actually cold pressed, mechanically extracted. It's kept in dark bottles so it doesn't become oxidized. It's usually an early harvest. Well, not usually. You want it to be an early harvest because it preserves the bioactive compounds that are within the olives. Now, what are the parts of the olive oil that are so beneficial for us? Well, it's actually something called polyphenols. There's a few different types of those, oleocanthal being the most important one. And when you take a good extra virgin olive oil and you take a sip of it, you'll feel a peppery, almost a burn in the back of your throat. Believe it or not, that's a good thing. The more that you feel, the better it is. So that's one of the first things you want to look for. Again, dark bottle, it's stored, cool, dark place, early harvest, and fresh, okay? They actually have a date on it, the way that wine would have on it. They are metabolically protective, they're neuroprotective as well. They help eliminate inflammation, they help with gut health, with brain health. They help the endothelial lining, that's the lining of our blood vessels. They actually help those stay healthy, which subsequently has cardiovascular protective benefits. They help reduce oxidative stress, and they help longevity in the overall. Now, processed food, which has become widespread in our country, ultra-processed food especially. You know, in today's day, children in America get 70% of their calories from ultra-processed food, and that's just horrible. They lead to things like chronic inflammation, metabolic dysfunction, cardiovascular disease. So you really want to stay away from those things. And I say it all the time, you want to eat whole foods. And you want to make, you want to make olive oil a part of your regular routine. A lot of people are familiar, they hear about the Mediterranean diet, Mediterranean populations, how they have lower heart disease, they have better longevity, they have a lower inflammation burden. Well, that's for many different reasons, one of which is that they do eat a lot of olive oil. But we'll talk a little bit more about that. But it's not just because it's fat, okay? They've got to be, they're minimally processed. They're high in polyphenols. And they lower their ultra-processed food load too along the way. So cortisol, we've talked about, is a direct link to our stress connection, right? Higher cortisol, more stress, more cortisol. It kind of feeds in on itself. So again, the polyphenols, which is what you want to find in your olive oil, you want to get at least 500 milligrams per kilogram. It'll be on the label. If you can get over 800, it's even better. There's a particular brand that I've been taking, it's almost as a supplement, not even a supplement, as a medicine, that's called The Governor. And it's got 1,400 or more milligrams per kilogram of the polyphenols. But these things help support metabolic stability, blood sugar regulation, mitochondrial health. They reduce inflammation. They do all these things. Now, if you can believe this, they work on the same biochemical pathway that ibuprofen does. It's called the COX system, COX, all capitals, COX-1, COX-2, and that's how pain signals get transferred through the neurologic system and tell your brain you're hurting, and they cause inflammation. Well, the polyphenols in olive oil actually interrupt the COX production. The same way that taking an Advil will interrupt that COX production, taking olive oil will do the same thing. But again, you've got to take the right kind of olive oil. Extra virgin olive oil with all the different criteria, you know, early harvest, cold pressed, young, not old, dark bottle, cool, dark place. It helps preserve all those factors that make it so good. it becomes oxidized and it loses its potency when it's in a clear storage container, when it's in plastic, when it's old, been sitting around a long time. It gets oxidized and it loses a lot of its benefits. So all of these things that we just talked about, the metabolic activity, blood sugar regulation, mitochondrial health, reducing inflammation, oxidative stress reduction, those things all have benefits to our nervous system regulation, our recovery, and our resilience to take on stress. All from olive oil. It's awesome. You know, a stressed body is very often an inflamed body. Our understanding of the ramifications of inflammation in our body have grown tremendously in the last decade. It is responsible for so many, if not a majority, of our ills and our woes. Cardiovascular disease being a big one. It affects the lining, the endothelial lining of our blood vessels, and it leads to heart disease and peripheral vascular disease. So, you know, sometimes getting your cortisol down isn't just about sedating yourself. It's about reducing the chaos that's going on in our body that's leading to all these negative things, right? So you want to make sure you've got extra virgin olive oil, dark bottle, early harvest. Look for the amount of polyphenols in there. Again, minimum 500 milligrams per kilogram, preferably over 800. Got to have that peppery taste. Your voice almost might change for about 10 or 20 seconds after you take a little sip of it. And why is that? Well, when they're harvested in this manner, they're less ripe. Now, that may sound like, oh, that's not a good thing, but it actually is, because when they're less ripe, they have more of the polyphenols in them. Now, why don't manufacturers make more of this? Because they get a lower yield. They get less oil from the olives when they produce it in the earlier stages of the growth cycle of an olive. So it's all about profit margins. You know, once again, putting profits before patience, right? I mean, I get it. They're in the business of making money, but you know, as a consumer, we need to know these things and then look for the right products, take charge and control of our own health and well-being. There's two particular brands. There's a lot out there, and one's called The Governor, and The Governor is by a family that is kind of like the Robert Mondavi of olives in Spain. The Picual, Picual, I believe is how it's spelled, the Picual olive, and they make The Governor, and it has over 1,400 milligrams per kilogram of polyphenols. It's a little pricey though. A bottle lasts me about a month, but there's another brand, Finca Galvez, same family, believe it or not, and it's much less expensive, and it's very, very high yield of polyphenols. And again, it's done the right way. How about some things you want to make sure you don't do with your olive oil? Don't overheat it. You heat it up too much, it breaks down. It becomes oxidized, and it loses its benefits. So around 350 is fine. 400 is okay. You know, you can saute your vegetables in it. You can cook eggs in it. You can bake with it. Deep frying might get kind of tricky if you get your oil over 400 degrees. If you start seeing smoke coming off your oil, well, then you're done. It's way too hot. So, you know, keep it down on the temperature and try to drizzle it on as much of your food as you can. Certainly, you can make your salad dressings out of it. On our website, UnProcessedSugar.com, if you go into the tips page, we have, I think, about 8 different salad dressings that are so easy to make. 4 or 5 ingredients, and olive oil is a big part of most of those. Use it daily. You want to make it part of your routine. The consistency is when you're going to really start to reap the benefits from this. You know, store it in a cool, dark place, and again, use it consistently. So it's not just a fuel. It's not just calories. It's actually giving our body instruction. It's signaling to our body what to do and how to do things in a manner that will actually heal your body. So now, you know, what makes extra virgin olive oil extra virgin? Well, kind of the things we've been talking about. You know, it's the least processed. It is not extracted using chemicals or heat. It's mechanically extracted. They press it, squeeze out the olive oil. They stay away from harsh chemicals. They stay away from the heat, and this really preserves all the good things that are within it. So, you know, I keep talking about polyphenols. You know, what are they? Well, it's a compound in the plant, in the olive, that's actually protective. it helps the olive plant take on stress and be resilient from damage. And then that actually translates to things for us, as I've been talking about, reducing inflammation, oxidative stress helps that, which we've learned a lot about, and in particular with mitochondrial health. That has a lot to do with longevity. Longevity medicine has gained a tremendous amount of legitimacy as of late because of the science that's behind it. So we really want to focus on mitochondrial health. When you hear those words, your ears should perk up and listen to what's being said. These lower quality oils, as I was saying before, not only do they get oxidized because they're old, the manufacturers will quite often dilute them with cheaper oils, which is horrible. And that actually happens a lot in the honey business. I've read that the majority of honeys on the shelf, especially the one with the plastic bear, are diluted with a lot of things that aren't even honey, like high fructose corn syrup. So then, they're going to lose they don't have the polyphenols that the extra virgin olive oil has. So we talked about the COX inhibition, and so all of these things have a lot of benefits, like I said, our cardiovascular system, but our brain especially. They help the blood vessel health in the brain, they help the circulation, oxidative stress reduction, and they actually protect the neurons. The neurons are the cells, the name of the cells that are in our brain. There's actually been some studies in the Mediterranean population who drink a lot of olive oil, that they have lower rates of cognitive decline. Now, the Mediterranean diet, Mediterranean population, they do eat a lot of olive oil, but they have a lot of other things that they do that help them. They have a strong sense of community. They move. They eat a lot of vegetables. They eat a lot of fish. So really, it's all those things together. It's not just that they eat a lot of olive oil, right? So these things will help your brain. Again, they've been shown in Mediterranean populations have a lower rates of cognitive decline. The brain is incredibly sensitive to inflammation, and its vascular health is very fragile. So again, the olive oil will help all that. So how much should you take a day? Try to aim between 1 to 4 tablespoons a day. I take about 3 tablespoons a day, 1.5 in the morning, 1.5 in the evening. I just pick it on a spoon and drink it. But in addition to that, that's the only oil we have at our home. So all the cooking, our salad dressings, we put it on vegetables, things like that. So I'm getting more than just the 3 tablespoons, but at least 1, try 2, 3, upwards of 4. I don't think you need to go a lot more than 4. It's a little cost prohibitive, and I think you start to, lose. It's a diminishing returns, right? Okay, so again, I talk about whole foods, real foods. They're not just calories. They're actually instructions for our body. So if you've gotten a lot out of this or anything at all out of this, please hit that subscribe button. We would really appreciate it. It helps grow our audience, get in the algorithms to reach more people. I really appreciate you joining us for this episode of Unprocessed Sugar. I'll see you next time. Hi, I'm Dr. David Sugar, a doctor here in Florida, and thank you for joining us on our podcast. A quick note, this is for educational and general information purposes only. Listening to this podcast does not constitute a doctor-patient relationship, and please consult with your own healthcare provider before making any changes to your own care. If you are having a medical emergency, please call 911 or your local emergency number. Any items, tests, medications that we talk about or discuss are for information purposes only and are not an endorsement. Once again, thank you for joining us, and please see the website for the full disclosure and waiver. Thank you very much.